Hi everybody, Dr. James Morgan back with you here today for the health of it. Today we're going to be talking about a topic that has been highly requested, my friends, sexually transmitted diseases or STDs, or how it is referred to nowadays as STIs or sexually transmitted infections. So let's get this started with first letting you know that it can be transmitted through oral, anal, vaginal intercourse, even genital touching. So of course, we've learned this since grade school, most of us anyway, that no form of birth control is 100% foolproof. Sometimes one might get past the goalie there, except for, of course, abstinence. But first, let me tell you that signs and symptoms of certain STDs aren't always obvious. Many times you might actually go without symptoms. But if you think you might have had one or been exposed to one, you definitely want to see your medical provider to get tested. And of course, to see if there's any type of treatment that might be needed. So if it is kind of a serious topic too, because if left untreated, it can actually cause more serious lifelong issues. So let me kind of go through the list of some of the most common STDs that are out there that are commonly transmitted. First, let's talk about gonorrhea. So the cause of gonorrhea is a bacteria. Symptoms that you might get: painful urination, urinary frequency, green vaginal discharge, or a white yellow type discharge from the penis, and of course, being male, you can get testicular pain. So the other one I'm going to talk about is the chlamydia. This is bacteria, and symptoms, a lot of times you're often asymptomatic or without symptoms. It can go again through painful urination, genital discharge, and painful intercourse. So a lot of times inflammation of the vagina might cause that painful intercourse. So before we get to that, let me just show you a picture. No, just kidding. We're not going to do that today. Another common one is trichomonas. It's a bacteria, usually part of the source, one of the many sources of vaginitis. This is where you can have vaginal discharge or even a strong vaginal odor. Another one, syphilis. Syphilis is caused by a bacteria again. This is where you come in asking or telling us as a medical provider, I have a thing on my thing. And one of the questions that we might ask you is, does that thing on your thing hurt? If it doesn't hurt, good chance it might be syphilis. If it does hurt, it could be something like herpes or kinkroid. Many STDs, there is no cure, like herpes and HIV, for example, but many have different types of treatment, and some that were actually curative as well. But it's important to know that if you've been exposed, if you think you've been exposed or you know that you've been exposed, to go see a medical provider, get tested, and get the appropriate treatment. Also be responsible, let your partner know that you've been tested positive, or those are the type of symptoms that you're having, so they can themselves go get tested and get treatment if it's necessary. So I'll leave you with this piece of advice my grandfather gave me as a young teenager in order to avoid me having any of these issues, is keep your pecker in your pants. Ladies and gentlemen, Dr. James Morgan for the health of it. See you next time.